Hello, and welcome to the initial training lesson for glucose testing with the Nova StatStrip glucose meter. This lesson is intended for all individuals who operate the Nova StatStrip meter, as annual competencies are required by the College of American Pathologists, Joint Commission, and Centers for Medicare and Medicaid Services. If you have any additional questions after the completion of this lesson, you are encouraged to contact your hospital's point-of-care supervisor. Once you complete this lesson, you should be able to demonstrate how to complete a quality control test, recognize when test strips and quality control solutions expire, explain proper hand hygiene and the required personal protective equipment necessary for blood glucose testing, demonstrate the blood glucose testing process using the Nova StatStrip meter, evaluate blood glucose results, and know how to report or document any critical values, name one common cause for inaccurate blood glucose results, and demonstrate the two-step process for cleaning and disinfecting the Nova meter. During today's lesson, we will cover 4 topics: equipment and supplies, the quality control procedure, the patient testing procedure, finding the policy or procedure within Policy Tech. First, let's take a look at the equipment and supplies that will be needed for testing. The Nova StatStrip meter is the only FDA-cleared glucose meter for critically ill and intensive care patient populations. Some notable features of this device include a touchscreen display, wireless result transmission, an analysis time of approximately 6 seconds, and an analytical measuring range from 10 to 600 micrograms per deciliter. Test strips should be stored in their capped, light-protected vials until use. Once the vial is removed from its box, the open and expiration date must be recorded on the vial of test strips. Test strips expire 5 months after their open date or the manufacturer's expiration date, whichever comes first. Additional strips are obtained through your hospital's supply chain. There are 2 levels of quality control solutions for the glucose meter, levels 1 and 3. Just like the test strips, the open and expiration dates must be recorded on the bottles of control solutions. These solutions expire 2 months after opening or the manufacturer's expiration date, whichever comes first. Additional control solutions can be obtained through your site supply chain. Single-use consumables, including lancets, gauze, or isolation bags, may be needed as well and should be available to you in your work area. When docked properly within the docking station, the glucose meter's battery is charged. As previously mentioned, these meters possess wireless capability, but in case the Wi-Fi is down, each unit has one hardwired docking station to ensure results can still be transmitted to the appropriate health records. The welcome screen of the meters at your institution should look very similar to this one. Be sure to acknowledge any device alerts that are listed in the center of the display. Once powered up, the welcome screen will display on the meter. To log into the device, simply press the login icon and then the scan icon. This will allow you to scan your ID badge's barcode or manually enter your login number. Once logged in, the patient test screen will display. From here, you'll be able to run patient tests, quality control tests, or review previous results. Now let's dive into the quality control testing process. Blood glucose testing is considered biohazardous by OSHA. Always use proper hand hygiene and wear gloves when performing patient or quality control tests. In order to verify test strip and meter performance, 2 levels of quality control testing are completed. Once every 24 hours, when test results conflict with the patient's clinical symptoms, when troubleshooting a meter, anytime the meter has been dropped, or if a vial of test strips is found open, we can use quality control tests to ensure that they are still good for use. And we always want to ensure that we're using proper hand hygiene and wearing our gloves, even when running a quality control test. Prior to performing the quality control tests, confirm the control solutions and test strips are not expired. From the patient test screen on the meter, press the QC icon. Now we'll need to identify the products we are using to perform the quality control tests. First, scan the barcode located on the vial of test strips. Next, we will scan the barcode off the bottle of control solution. These numbers may also be manually entered using the keypad displayed on the meter screen. After identifying our testing supplies, you may insert a test strip into the meter. Gently mix your control solution and discard the first drop. Place the second drop on the cap of the control solution. From here, you may dip the test strip into the control solution. After drawing the specimen into the test strip, the meter will display your result as pass or fail. To accept a pass result, add the comment "meter cleaned" and then select accept. Remove the test strip using the hands-free release and discard in the regular trash. For any failed quality control results, enter an appropriate comment to document any steps taken to resolve the failure. If a quality control test fails 3 times, discontinue further testing with that device and contact the lab or your hospital's point-of-care supervisor. Now let's take a look at the patient testing procedure. Listed below are the appropriate collection sites for different job classes. Please note that for our neonate patients, capillary and arterial blood are the only acceptable specimen types. The use of alternative sites, including the earlobe or forearm, are not permitted as they will yield inaccurate results. Low oxygen saturations, pale skin color, or cool skin temperature may indicate poor perfusion in a patient. If a patient has signs of poor perfusion, capillary specimens are not recommended. Arterial or venous specimens should be used to test a patient's blood glucose with poor perfusion. For any unlicensed assistive personnel, if you are unsure if the patient has signs of poor perfusion, contact the patient's nurse for further assessment. For patient testing, from the patient test screen, press accept. Next, we'll need to scan the barcode on the vial of test strips. Once scanned, remove a test strip from the vial and insert it into the meter. Next, we'll scan the one-dimensional barcode on the patient's wristband. If you are unable to scan this barcode, you may manually enter the 9-digit number listed under the 2-dimensional barcode, as outlined in green in the example above. Once scanned, the patient's name, ID, and date of birth will be displayed on the meter. If patient information is not displayed, verify the information listed on the meter and select the downtime override to proceed to testing. If your information is listed, acknowledge the information is correct by selecting the Accept button. Afterwards, you'll then select the appropriate sample type for the test you're performing. Wash and dry the patient's finger or heel with soap and water or a BZK towelette. We should avoid using alcohol wipes as they can lead to excessive drying and cracking of the skin. Hold the finger or heel pad downward and massage towards the tip to stimulate blood flow. Using a single-use safety lancet, puncture the skin per protocol. Wipe away the first drop of blood and allow a second drop to form. Touch the end of the test strip to the blood drop. The test strip must completely fill upon touching the blood drop. If it does not fill completely, discard the test strip and repeat with a new test strip and fresh drop of blood. Once there is enough blood on the test strip, a countdown will begin and the blood glucose result will display after approximately 6 seconds. Do not remove the test strip while the countdown is in progress unless you want to cancel the test. After your test is completed, use the hand-free strip release to discard the used test strip into the regular trash. On the review results screen, your glucose test result will be displayed. If no action is warranted, select the Accept button to send the result to Epic. If action is warranted, we'll need to select a comment that will be attached to the value. This is a multi-step process that includes adding a comment to the result, saving the comment, reviewing both the comment and the result, and finally accepting to send the result and comment to Epic. Arrows on the review results screen indicate abnormal and critical values. One arrow in either direction, up or down, corresponds to an abnormally high or low blood glucose result. Two arrows in the up or down fashion indicate either a critically high or critically low blood glucose result. For results outside of the normal reference range, we encourage individuals to follow hospital policy or the physician's orders with regard to that patient's course of treatment. For diabetic patients, we may need to initiate the hypoglycemic protocol or hyperglycemic protocol, depending on the results obtained. In adults, if the result is less than 70 milligrams per deciliter, hypoglycemic protocol requires retesting the patient 15 minutes after the patient was treated. Critical result documentation is mandatory. If a critical result is obtained, we may add the comment chart critical test or Dr. RN notified to that specific test result. Up to 3 comments may be added to each test result. We encourage operators to utilize these comments as they assist when investigating any irregular test results. If the meter shuts off before a comment has been entered, we ask that staff document the test result and any additional notifications in Epic. Comments may also be added to any blood glucose result, not just high and low values or critical results. And again, we do encourage staff to utilize these comments when appropriate. Common causes that may lead to inaccurate blood glucose results include incomplete or inadequate patient preparation, poor capillary perfusion, edema, or expired or mishandled test strips. Cleaning and disinfecting the meter after each use is essential to maintaining a safe work environment. This is a 2-step process. We recommend cleaning and disinfecting the meter over a paper towel covered counter to limit the distance the device may fall if dropped. To clean the meter, using one germicidal wipe, we'll wipe the surface of the meter, removing any visible soil. To disinfect the meter, we'll use a new germicidal wipe to wipe the surface of the meter a minimum of 3 times vertically and then 3 times horizontally. Allow the meter to air dry and dispose of the soiled wipe and gloves into the regular trash. It is not recommended to bring the glucose meter tote into the patient's room, as the tote then would require the same cleaning and disinfecting process after exiting the patient's room. As previously mentioned, these glucose meters possess the ability to wirelessly transmit test results. Wireless meters are programmed to automatically send these results to Epic when the Accept button is pressed after analysis. If the Accept button is not pressed when the results are displayed, the results will not be sent to Epic until the meter is returned to its docking station. At sites that do not possess wireless capabilities, Your meter will have to be docked in the docking station in order for these results to be transmitted to your patient's electronic health record. Now let's take a look at how we can find the policy within PolicyTech. PolicyTech is an application that is accessible through the Fairview intranet. When opened, you may use the search term NOVA, N-O-V-A, and that will link you to the complete procedure for the NOVA StatStrip meter. In summary, take only what you need to perform your blood glucose test into your patient's room. Test strips expire 5 months after opening or the manufacturer's expiration date, whichever comes first, and open and expiration dates must be recorded on the vials when removed from their box. Quality control solutions expire 2 months after opening or the manufacturer's expiration date, whichever comes first. Open and expiration dates must also be recorded on the bottles of control solutions when they've been removed from their box or packaging. 2 levels of quality control tests are performed once every 24 hours if test results conflict with the patient's clinical symptoms, when troubleshooting a meter, anytime the meter has been dropped, or if a bottle of test strips is found open, we can use quality control tests to ensure that they are still good for use. Acceptable sample types include whole blood capillary, arterial, and venous blood for children or adults, whereas our neonate patients will be restricted to whole blood capillary and arterial blood only. If we're questioning a patient's perfusion, capillary blood should not be used for blood glucose testing. Blood glucose testing is considered a biohazard, and as a result, we should always perform proper hand hygiene and wear gloves when testing. Always wipe away the first drop of blood and dip the tip of the strip into the second drop. A patient, nurse, or provider must be notified if any critical values are encountered. Additionally, we must also document this notification within Epic. Cleaning and disinfecting the meter is a 2-step process. Docking the meter will send results to Epic if your institution's Wi-Fi is temporarily down, and will also keep the meter's battery charged. The glucose by meter NOVA Biomedical StatStrip procedure can be found within PolicyTech on the Fairview intranet. Remember, to maintain testing access, you must annually perform both the high and low quality control tests under your own operator ID after the completion of this LMS lesson. The recertification process will always include an electronic lesson and then performing both levels of quality control testing. This completes your lesson for today. I hope you found this extremely informative, and again, I encourage you to reach out to your hospital's point of care supervisor if you have any questions after the completion of this lesson. Thank you.